does healthcare e-health platform has helped you to has helped the key speakers to present your thoughts among the other key speakers and the industry leaders here?
Okay, I think e-health, so my association with e-health is almost 6 years old. Okay, I have been part of e-health conferences in the West from almost 2009 was the first time I think I spoke in one of the e-health conference at HLF. I think it brings in what is typically happening, what's going to happen, right? That's the I think e-health has been bringing in. I think that's what they need to focus on. I think if I look at all the complete panel that I was part of and maybe the rest of the sessions also, I think you are taking care of what is industry doing, what is government doing, how can people collaborate, what are the new products which are coming in, and what I tried bringing in also was what's the future, right? Because although yes, our country is still struggling, on standardization and coming up with an EHR, which is a government product which really works across. And we just heard the Joint Secretary talk about it also. And of course, we've got a wonderful national health policy which has just come out. So we're making a beginning. But I think it's also important that we need to keep an eye on the future also while we create the complete platform. Otherwise, we will be left behind. And that's what I tried bringing in, that look, this is what's coming. Because with the number of hospitals that we're creating, the number of AIIMS that we're creating, the number of medical colleges we're creating, we will not be able to create the capacity that we need for the future. So I also work in education space. So my thought is also to say how we could use different technology to actually create that capacity. So that's what I was trying to do.
Yeah, I saw it in your presentation. You were talking about Internet of Things. But there are the IT is booming, and it is being interlinked with almost all the sectors now, be it manufacturing, be it education or healthcare. So do you think that still there is a challenge of adoption of the IT technologies in in healthcare sector?
Absolutely. I mean, I've worked before joining government. I was part of a corporate hospital, and as a CIO, I have actually worked very closely with the doctors, and I've seen that it is actually challenging for the doctors, because I think so there are two parts to it actually, because the doctors haven't been groomed, although they're the best doctors in our country. They're very technologically savvy doctors. They do WhatsApp faster than what we do. They do Google faster than we do. They do Facebook faster than we do. But when it comes to they're typing on data on the health records, they are not even comfortable. So that's so they haven't been groomed to do that. So all of us, our children today have been groomed to work on Facebook or internet from class 3 or maybe class 2, or you see an ad of one of the telecom company where you see that the child when he comes out, when the baby is born, the baby is actually on iPad. Right. But I think what we need to do is to possibly take education on healthcare to medical colleges and to schools, which we are not doing. Children can work on iPad, small children can work on iPad. Possibly they can also get some information about different preventable diseases, while they're in school. So we actually create capacity from possibly the time when the child is in class first. They all know what is temperature, कि हाँ मेरे को fever हो गया या बुखार हो गया. Can we also tell them more about the do's and don'ts of what they need to do for different type of problems in healthcare? So we need to work on capacity planning, I think. And capacity planning is also not only building up doctors, it is also building in different kind of people who can actually support healthcare. And I'm trying to relate this to what we did in IT. In IT, we do have BCAs, but we created BCAs, we created MCAs, we created NIMETs who would create different kind of training programs. And so on and so forth. We created NITs which churned out people who could teach, train in Java and others. So people who were not even technology graduates started doing programming, and that's how India became what it is today in IT. similar in terms of capacity planning in healthcare. We don't need only the doctors actually to cure patients. We need a lot of other health workers to create it. But I think we are really lacking there. And I've heard that there are a lot of Ayurvedic doctors who are not GPs, but then we need nurses, we need a lot of other paramedic staff, we need MBAs in healthcare, we need a lot of other education support staff in healthcare. And we need that coming to every house, which means that it needs to be school education, it needs to be college education. Like today, we teach Java, and if you're doing civil engineering, you can do a course on Java, right? So similarly, if I'm doing civil engineering, can I also do a course on health informatics or health? So that's what I'm saying. So I think it needs to go down to our basic education level to create it.
So do you mean to say that only at the education level, when a child is growing in his growing years, this should be, we are talking about the technology linked with the sectors?
You have, I think, children are taught basic in second class these days. Or to use computer, they're taught to play games in second class. We also tell them to treat, small patients. We can create some games of treating patients, which they can do. They see it at home, but possibly if they do it, they'll possibly be aware of what temperature is, what glucose level is, what you do to control the glucose level, and so on and so forth. So this could be a beginning of a different kind of a society who is health conscious, and you actually creating prevention in healthcare from the beginning. That's what I can say.
What future do you see of the IT, of the adoption of IT in the healthcare, especially after the budget of 2015, Union Budget 2015, where the allocation has been given from IT and to the healthcare also?
See, I think there's a huge plan in terms of digital India, in terms of connectivity, but it's going to take time. See, baby cannot be born in a day. It's going to take some time. We're going to lay fiber, we're going to do this. And as part of Digital India initiative, our ministry is also looking at innovative way of how they could do this connectivity in a faster and a cheaper way. But it's going to take some time. So I think we heard one of the speakers talking about that there are some places in the interiors of India where the phone line also doesn't work. What to say of internet? We totally agree that that's a reality. But we need to start working on changing that reality to a time that we will have internet. So we have our ministry has very aggressive plans. Ministry of Information Technology of NFIN and related NIA. We just heard about national information infrastructure. There's another project that's coming in, which actually is going to bring in not only connectivity but also the applications across the village level and also the levels possibly he spoke about, where there's no connectivity. We're taking connectivity to Northeast area, we're taking connectivity to Andaman Nicobar and absolutely the remote areas of India. We're looking at technology, how to make it stable when it rains, which is another point I think which came in, that when it starts raining, the connectivity just stops working. So there is a special initiative from the ministry where we're looking at how we could have stable connectivity in the areas where there's heavy rain and the connectivity goes bad due to that. They're talking in terms of VSAT connectivity and others, which are more stable during the rainy time. So there's a parallel initiative that's happening. But yes, it cannot happen in a day. There is a strategy, there is a plan. The execution of the plan has already begun, but it's going to take some time.
Thank you so much, ma'am. Thank you for your inputs. And it was lovely talking to you.